Alcohol, one of the most common drugs on the world. Everybody knows it, a lot of people drink it, and this is a video about what alcohol actually is, how it does affect your body, how your body metabolizes alcohol, and then why people drink alcohol, and also why you shouldn't drink any alcohol after this video. So let's get started. First of all, what is alcohol in a chemistry way? Actually, alcohol is just the name for groups, for chemical groups, the so-called hydroxy groups. So you have an element, and this element has an oxygen and an hydrogen attached to it. That's an alcohol. But colloquially, people actually use alcohol as a synonym of ethanol. Ethanol is a psychoactive and toxic substance that can use dependence. So that is actually ethanol. So you have two carbon groups attached some hydrogens to it, and this is the hydroxy group that I talked about. And that's a substance. So now we can go further. So what happens if you drink alcohol? First of all, it goes through your mouth into your body. And then most of the alcohol will be absorbed in the proximal small intestine. Also, some alcohol will be absorbed before it and some after it, but the main proportion of alcohol will be absorbed in the small intestine. From then on, it goes through the small intestines, let's say it like that, and it goes into your blood, in your blood system, in your vessels. From there, it can go to your whole body. So two main organs that are affected by alcohol are the brain. Therefore, we have the symptoms for drinking alcohol coming from the brain. And second of all, we have the liver, where most of the alcohol is metabolized. So, how is ethanol actually metabolized? You can get energy from alcohol. That's why alcohol has also calories. So how we can go from this to energy? So here is the ethanol that I talked about. This ethanol has three ways to be metabolized. First of all, we have the catalase. This is some enzyme that is in peroxisomes. You don't have to worry about this. This is just a cell organelle in your cells. And it has this enzyme, and they're actually, let's say it like that, they're all like the toxic fabric of your cells. And this is the enzyme for that. And from there, we come to acetaldehyde. That's this substance. There are also two other ways. We have another X enzyme, the alcohol dehydrogenase, and also we can go about the monooxygenase. These are the three enzymes who metabolize alcohol or ethanol into acetaldehyde. You can see the differences here. You have one less hydrogen, therefore a stronger binding of the oxygen, let's say it like that. With monooxygenase, there is a funny thing. If someone drinks a lot of alcohol, this monooxygenase is upregulated. So this person has more monooxygenase. So he can deal with alcohol better. So your liver actually adjusts to your drinking habits. One dangerous thing is with the monooxygenase, you have this ROS. And does it stand for it? That are reactive oxygen species. For example, O-. So not O2, oxygen, we need it, we breathe it, O-. And what does it do? These are reactive substances. And they can actually destroy your cells. You have different mechanisms to actually don't make these reactive oxygen species dangerous. So they take them and then they make them to something that it's not dangerous, HO2, for example. but H2O, and yeah, but these are the dangerous things, and if you have too many of them, your mechanisms uh, cannot absorb all of them, and it actually can damage you, especially your liver. Then we have this acetaldehyde. This acetaldehyde goes from the aldehyde dehydrogenase, that's another enzyme, to this little thing. This is acetate. Acetate is actually sour thing, let's say it like that. And this one goes to acetyl-CoA. And acetyl-CoA, it's completely normal and you have all the time in your body. When you, for example, eat fatty acids, this acetyl-CoA is the last part of this fatty acid. And this acetyl-CoA, from there, we can go to about a lot of other ways we can get energy. So that's how we have this energy source. We can also build fatty acids with this substance. That's why when you drink alcohol, your fatty acid synthesis goes up and your fatty acid metabolism goes down. Some people say that's why when you drink a lot of alcohol, you have a beer belly, so you store fat, because the fat metabolism goes down and the fat building goes up with alcohol. There's, in my opinion, there's also, I don't know if it's true, but I think it also has a lot to do with caloric deficit or not deficit, but that's another video. And yeah, and one medication that actually helps people who go away from drinking too much alcohol is disulfiram. And what this medication does, it inhibits this enzyme. Therefore, their acetaldehyde, it gets more. It cannot be metabolized, and so the metabolism stops here, and you have more acetaldehyde. And acetaldehyde is actually the thing that is causing some symptoms and is the dangerous toxic thing. Not alcohol, but acetaldehyde. Therefore, people get more nausea and they don't feel well, and therefore they hopefully stop with alcohol if they take this medication. There's also a problem if you don't stop, your metabolism is inhibited and you get more acetaldehyde, and it can lead to a acetaldehyde intoxication. As always, don't take any medication without consulting your doctor. Okay. And other symptoms like the typical hangover is actually not from alcohol or acetaldehyde, it's from the dehydration. Why do you have a dehydration when you drink alcohol? Why? Because alcohol actually inhibits the secretion of vasopressin, ADH. And ADH or vasopressin is actually something that helps or sends a signal to your kidneys to restore water and don't eliminate a lot of water from the system. Without this hormone, your kidney thinks, yes, we can eliminate a lot of water, and so you go more to the toilet, you have more urine, and your water goes out of your system because you don't have this hormone that gets inhibited, or the secretion of this hormone gets inhibited by alcohol. This hormone is actually from your brain, a specific area of your brain where a lot of hormones get secreted. Maybe another video. If you want to know the actual effects from alcohol on your brain, on which receptors, you can write it in the comments. Maybe we'll do another video about that. So let's get to the second point. Why do people actually drink alcohol? Why do they take this drug? People typically drink alcohol to induce euphoria or reduce anxiety. There's also something that's called with social settings, your peer pressure. For example, you have a meeting anywhere and everyone takes a wine. Then you have also this pressure from your peers to also take wine and drink alcohol, because everyone is doing it, and it's something that you don't feel it's maybe right to don't drink it. Just to say it, it's absolutely fine. It's okay if everyone drinks and you say, no, I don't want it. It is actually good for you. There's also a reward system if you drink alcohol, dopamine, and so on. So you get rewarded with drinking it. And there is actually scientific based evidence from fMRI that actually there is an acute pharmacological rewarding and an anxiolytic effect of alcohol. I have the sources down in the description. You can look it up. It's, I think, from the National Health Organization, so a pretty sure source. And if you want, we can read it up. So let's get to the next point. Why you shouldn't drink alcohol. Just some facts. In 2019, there were 2.6 million deaths caused by alcohol consumption. And from these 2.6 million, 2 million were male and 600,000 were female. So males are more exposed to the danger of alcohol, and also the average male drinks more alcohol than an average woman. And one thing about these 2.6 million deaths, 156,000 of these deaths were caused in a traffic accident where someone who didn't drink alcohol died. So someone drank alcohol, then said, yeah, I can drove with alcohol in his system, and then made an accident and someone else died. That's also something to think about it. Never drink alcohol. It's not only when you're driving, at least. It's not only because for your safety, it's also the safety of others. So if you don't think about yourself, think about others, because you can get someone else killed for your mistakes. And that's something that's easily, it's not something that is necessary, you know? So never drive with alcohol in your system. Okay. And another number, 400 million people, so 7% of the 7% of the whole population between 15 years and older has actually a disorder, an alcohol use disorder. And overall, the proportion of people who get treated with this disorder is less than 1% to no more than 14% in those countries where data is actually available. So there are a lot of people who have this alcohol use disorder, and not many get help from it. It's always okay to get help and to seek out for help too. That's why there are so many people who are there for you to help you and to help you to get out of this disorder. So no, there is no shame in it. And 1 to 14%, that's nothing. 14%, that's nothing. So if someone you know has problems, or even you, it's no problem to seek out for help. So then another fact, even at low level, even a drop of alcohol can induce diseases. So there is no risk-free alcohol consumption. You cannot say 1 beer per week is risk-free. Every drop of alcohol is not risk-free. But of course, the chances or the risks of alcohol drinking are increasing with the frequency of drinking, and also the numbers or the heavy episodes of drinking. So someone who has heavy episodes with drinking and also drinks frequently has, of course, a higher risk of different diseases than someone who drinks less. And what are those diseases? We have liver diseases, we have a lot of cancer varieties, and also mental health diseases, and also behavioral conditions such as this depression can come from alcohol. It can induce anxiety about long term. So first of all, it's anxiolytic, but it can induce anxiety also as a symptom on a long term, and a lot of all other alcohol use disorders. And it's actually a carcinogen. That means it can induce, or it can, let's say it like that, it can up your, it has, you have more, a bit of risk of getting diseases for cancer than without it. It can induce cancer. What cancers? Breast, liver, head, neck, esophageal, and also colorectal cancers. And there is also a causal relationship between that has been established between alcohol use and incidence or outcomes of infectious diseases such like tuberculosis and HIV. So what does this mean? There is actually a causal relationship between drinking alcohol and such diseases like HIV and tuberculosis. And what does a causal relationship mean? Just an example here. You hear it a lot in medical school and in psychology. That means there are two different types of relationship. You have a correlation and a causalization. A correlation, for example, we have smokers. Smokers tend to have more lung cancer, but smokers tend also to have more pets. I don't know if that's true, that's just an example. They have more pets. So you could say people who have more pets also have a high probability of lung cancer. But there is no causal relationship. There is no cause why pets should induce lung cancer. At least it's not known to me. And the mediator between those two variables is smoking. So people who smoke tend to have more pets and also tend to have more lung cancer, or more on average many lung cancer, more lung cancer. Yeah. So this is the causal relationship and also a correlation between having pets and lung cancer. Okay. And one other important thing about pregnancy. First of all, if you drink alcohol when you're pregnant, and that's in kids in utero are like with 10% of all kids are exposed to alcohol toxicity in utero, so in their mother. 10%, that's a lot. And there is this symptom that's called, or the syndrome, FAS. And what does it stand for? Fetal alcohol syndrome. So that's a disease or a syndrome that people or kids who had alcohol toxicity when they were in their mother, and it contains abnormal phases, growth deficiencies, mental retardation, attention problems, intellectual impairments, learning disabilities, and behavioral problems, and also alcohol-related neurodevelopment disorder. And it's not only when you have the child, when the mother has the child and drinks alcohol, also when you're conceiving a child, it's important to don't drink alcohol, also for the male part. So both male and female, in the best case scenario, that have no alcohol in their systems when they're conceiving a child. This can also lead to this syndrome or other syndromes or can actually damage the child. Of course, there are people that nothing happens when they're conceiving a child and they're drunk, or actually maybe someone out there knows that from you, maybe some people you know. And also there are people who their child doesn't get damaged when they're drinking alcohol when they are pregnant. But the question is, do you really want to have this risk? Do you really want to have this risk on your own unborn child? Just something to think about it. And of course, there are also differences between age, sex, and also people have higher susceptibility than others. For example, a 120 kg bodybuilder can take more alcohol without any symptoms than a 50 kg old grandma. There are differences. So how do you know maybe someone could have an alcohol addiction? There is actually a test, a screening test, and if you have 3 or 4 answers right, could indicate alcohol disorder. That's not we are not in a hospital here. If you have problems, contact your doctor. I always say that I'm just a medical student. I'm no doctor. I don't know anything. I just want to share some knowledge. And yeah, so let's get to the test. The test is called CAGE, and each letter stands for one question. First of all, we have C. Have you ever felt you should cut down on your drinking? A. Have you ever become annoyed by the criticism of your drinking, by others, for example? G. Have you ever felt guilty about your drinking? E. Have you ever had a morning eye-opener to get rid of a hangover? So those are the 4 questions who stand for the 4 letters. And if you're someone who has 3 or more questions right or positive, then this could indicate an alcohol use disorder. And what is an alcohol addiction? An alcohol addiction, you have various symptoms like reduced general conditions. You have also muscle atrophy, especially in the calves. Interesting. But yeah, you have muscle atrophy, especially in the calves. And you have also sleep problems and gastrointestinal problems. And with the cerebellum, so your little brain, cerebellum, you have intention tremor. So when you, for example, go somewhere, you have this tremor. And you have also dysarthry. That means that you cannot articulate very good. And there's also ataxy, when someone walks and cannot walk properly. And there's also nystagmus, and that's something. It's a medical term when your eye swings a little bit like that in different. For example, in a test, then your eye goes like that. That's a test you can take with your doctor. Maybe another video about that. Okay. And your cerebrum can actually also get damaged by the alcohol. So you have cognitive deficits in your memory and also on your concentration. And there's also the alcohol polyneuropathy. And polyneuropathy in alcohol is like when the vibration, you cannot feel the vibration very good in your fingers or in your toes. You can test that. Or you don't have this sensibilization in your fingers anymore. It gets damaged, the nerves get damaged. This is also something that, for example, diabetic people have. And there's also the alcohol-related dementia. And what happens if you withdraw alcohol? You have withdrawal complications. You have vegetative symptoms, for example, tachycardia, your heart is faster, and there is also sweating as a vegetative symptoms. And on the other hand, you have also neurological symptoms, like you have orientation problems, and you have a delirium tremens, so you're a little bit confused and don't know what's happening. You say things that doesn't make any sense. And there is also, of course, secondary diseases from drinking alcohol, cirrhosis of the liver, a Wernicke-Korsakoff syndrome. What does this mean? Your brain is actually damaged by your drinking, and then you your brain is damaged and you cannot do things that you used to do. And as already said, the peripheral polyneuropathy. Okay, so let's get to a conclusion. We have these things. We learned how alcohol is actually, what is alcohol and how it is metabolized in our system. Why people drink alcohol, what some facts about alcohol, and also a screening test. And what my problem is that alcohol is very socially accepted. For example, if you would make a comparison, some new drink, some new fluid comes on the market, and it has all these symptoms that alcohol also has. Do you think anyone would drink it? I don't think so. It's socially accepted, and that's why so many people drink alcohol. And there is also a positive message here. From 2010 to 2019, there was a 20% decrease of deaths caused by alcohol consumption. So there's a decrease in this category, which is very good. And with this video, I just want you to be aware of drinking alcohol, so you can make an informed decision. And one other point that I want to make with this video is, it's okay to don't drink alcohol. Even if your peers say, hey, why you don't drink alcohol? Let's drink together. Maybe those aren't the peers for you. Maybe you should need other peers. Or you say, no, I'm fine, thank you. For my case, I never drank any alcohol in my life, not a drop, and I will not drink any alcohol in my life. Religion can also help you there. There are religions who say, no, we don't drink any alcohol, but you don't have to be religious. You can also just say, this is a drug and I don't want it, and I don't want the risks. And yes, maybe you can have fun with it. You can have fun more this night. But you have to think always in your life, do you want to have fun or happiness in the long term? Some guy can have fun every night until he's 30, and then he asks himself, I'm not happy anymore. Because, yeah, I had a lot of fun, but I'm not proud of myself. And also, someone drinks one night, and on the other day, he is like, I'm not happy, man. I have a hangover, I'm not feeling well. All this because of 2 hours of excitement. I could have also excitement without it, if I just had said, no, I don't drink, and I'm happy with it. So, you don't have to drink alcohol to have fun, and it's actually better for your overall happiness, in my opinion. And just at least try to not drink too much alcohol. So thank you very much for listening. If you have any questions, you can write it in the comments. I have wrote the sources in the description. And if you have any other ideas about videos about alcohol or something completely different, how does the heart actually work? How does the heart pump? There will be new videos in the next weeks, every day on Saturday at 11 o'clock here in Germany, or in the US on another time, I guess. But every day, Saturday, there will be a new video about a medical theme like this one. And I hope you enjoyed it. And let's see you at the next video.